Hello, my name is Ebelin and I'm a Harper nursing student. I'm here to perform a general assessment, head to toe assessment. Is that okay?
Yeah.
Alright, I'm going to start by asking you a few questions. Can you please state your full name and date of birth?
Yeah. Gerardo Bahena, November 19, 1990.
Okay, Gerardo, can you tell me where you are and why you're here?
Yeah, in my room to receive a complete head to toe body assessment.
Alright, Gerardo. Can you tell me what the day is today?
Yeah, April 24th, 2018.
Alright, and do you know who the president is?
Yeah, Donald Trump.
Alright, and do you remember my name?
Yeah, Ebelin.
Okay, the patient is alert and oriented ×4. His level of conscious is normal. Speech and communication is clear. Patient's Gerardo's vital signs were taken prior to this. His heart rate is 72, blood pressure is 122/61, respiratory rate is 18, temperature is 98.6, all within normal limits. Client is 5'9", he weighs 176 pounds. BMI is BMI is 26, which is categorized under overweight. Next, I would perform a Snellen chart, testing cranial nerve number 2. I would ask the client to stand 20 feet away from the chart, covering one eye at a time, reading the lowest possible line of letters without missing any letters or struggling. And then I would interpret, and Gerardo has 20/20 vision, so that is interpreted as the client can read at 20 foot, where regular vision can read 20 feet away. Okay, Gerardo, I'm going to start my assessment by just inspecting or assessing your head. The patient's head is normocephalic. Don't notice any protrusions. I'm going to palpate for any dentations or protrusions, any tenderness. Did that hurt?
No.
I'm assessing his hair also. Client just showered, so it's appropriate. Next, I'm going to move on to your face. Can you open your jaw? Okay, I'm feeling the temporomandibular joint. Did not notice any crepitus or limited range of motion. I'm going to palpate the maxillary and the frontal sinuses. Did that hurt?
No.
Okay, I'm feeling for heat or tenderness, which were not felt. Next, Gerard, I'm going to move on to your eyes. I'm going to perform a test called 6 cardinal positions of gaze. Can you follow my pen light? Good. And then just focus right here. This is an accommodation test. Very good. So that's testing cranial nerve number 3, 4, and 6, which are all intact. Next, I'm going to perform a light pupillary light reflex. And I'm checking to see that both the pupils constrict, and I would document this as perla. Pupils are equally round, reactive to light and accommodation. Next, I would check the conjunctiva to make sure it's pink and moist, and the sclera is white. Moving on to the ears, I'm inspecting the internal and external meatus, auditory meatus, and I'm feeling for any abnormalities, any lesions or tenderness. Did that hurt? Any pain? No? Next, I would perform a whisper test, and this is testing cranial nerve number 8. Can you repeat after me? Or can whisper back what I'm saying?
Pizza. Torta.
Alright, very good. Eyes, ears, nose. So next, I'm inspecting the external nose, and I'm going to palpate and to make sure it's symmetric and if it's in place. And says any pain? Was that painful?
No.
Okay, and I don't notice any lesions. Septum is aligned, symmetrical. Okay, now I'm going to assess the patency of the nostrils, nasals. Okay, can you cover one nostril, please, and breathe in and out? Nares. Good. Moving on to the mouth. I'm assessing his lips. They're appropriate. They're not dry. They're not cracked. Can you open? I'm going to assess the mucosa. I would do this with a whipstick with a patient. I'm assessing the teeth, the gums, the floor of his mouth, and the top palate, and it's moist. I don't notice any redness or lesions. He sticks his tongue out. Can you stick it out? Okay, that shows that cranial nerve number 12 is intact. Tongue is midline. Moving on to his uvula and the tonsils, assessing that. Can you say ah?
Ah.
Good. his uvula raised, so it shows cranial nerve 9 and 10 are intact. All right, moving on. Yeah, that's it for the mouth. Moving on to the neck. I'm assessing to see if there's any enlargement of any glands, parotid glands, and salivary glands, and the thyroid glands. And they don't look enlarged, and they don't feel enlarged either. Okay, I'm going to assess his range of motion. Gerardo, can you turn to the side for me? Good. Can you tuck your chin in? Can you look up? And then ear to shoulder. Very good. I'm going to assess for cranial nerve number 11, shrugging against resistance. And then can you turn against resistance? Good. And then I'm going to palpate his neck and subclavicular, supraclavicular nodes, lymph nodes, starting with the preauricular, postauricular, occipital, submental, submandibular, jugular digastric, superficial cervical, deep cervical chain, post-cervical, and then can you shrug your shoulders? I'm feeling in here for supraclavicular. Good. Thank you. Next, I'm going to feel for his carotid pulse. Okay. And I did not notice any abnormal rhythm. They're both about the same. Now I'm going to listen with the bell of my stethoscope for any brewy sounds. Okay, thank you. Go ahead and remove your shirt. Next, we're going to move on to the chest assessment. No, go ahead and sit down still. So right away, I'm assessing the client's skin and it's appropriate to ethnicity. I don't notice any jaundice, any cyanosis or paleness. Client is slightly light, and he does have a tan, but it's appropriate because it's sunny out. Next, I'm assessing his respiratory rate, the rhythm, and the depth. I don't notice any use of accessory muscles. When I look at the back, the posterior of his chest, I'm assessing the expansion of his lungs when he's breathing. Take a deep breath for me. Good. Don't notice any bruises, any lesions. Skin is warm and dry. Turn around. Okay, skin is warm and dry also. Next, I'm going to take a listen to your lungs. There's 5 areas in the front that you want to listen to. So I would start with the throat, and that's listening for bronchial sounds. Nice deep breaths. Good. Let me know if you get lightheaded. Good. Nice breaths. Okay, listening around the sternum area gives you good, you're able to hear the bronchial vesicular sounds. Okay, and then moving down, you're able to hear the vesicular lung sounds and the lung fields. Good. Face the wall for me. Face your arm. Right side of the chest, if you want to listen, lateral side, I want to listen to 3 sides. Good. Now we're going to face the back. 9 areas of the back of the lungs that you want to listen to. Bronchials up here. Bronchiovesicular. And then as we move down, it reaches vesicular lung sounds. Good. Thank you. I'm going to turn around. And on the left side, I want to listen to 2 areas. Good. Alright, we're going to move on to the upper extremities. So I'm assessing the arms. Don't notice any lesions, color, skin is warm to touch. I'm going to assess the, Gerardo, I'm going to assess going to assess your nail beds. I'm assessing the capillary refill also. And then can you go like this? We're assessing the profile sign, making sure it's less than 160. Spread your hands out, and we're going to assess the radial pulses. Can you turn around? Compare them together. Okay, good. And while you're here, keep your hands out like that. We're going to bring your assess the range of motion. Can you bring your wrist down, back up to the middle, up, spread your fingers out, close them, down, fingers down, supinate, and then give me a flex. And now can you do an arm circle, assessing the shoulder range of motion. We're going to assess the strength of his hands. Can you give me a squeeze? And then the strength of his elbows. Okay, good. All right, go ahead and have a seat. Next, we're moving on to the heart. But before that, I'm going to have the client lie down at a 45-degree angle. I'm assessing the jugular vein, if there's any distension. And I don't notice any. As the client lays down, I'm assessing to see if there's any abnormal pulsation going on, and I don't see any. I'm going to listen to your apical pulse, okay, Gerardo? And then I would find that midclavicular fifth intercostal space. Listen for 60 seconds. Okay, S1 and S2 sounds are present. Rate and rhythm is regular. Now I'm going to listen to 4 different areas with a diagram of my stethoscope. Aortic, pulmonic, tricuspid, and mitral. I'm going to switch to the bell of my stethoscope and listen to the same areas. Aortic, pulmonic, tricuspid, and mitral. Okay, S1 and S2 sounds were present. No irregular rate or rhythm of the heart sounds that I noticed. Moving on to his abdomen. At this point, I'm assessing the contour, which is flat, and then the symmetry, which I would align it, want to make sure that it's aligned with the umbilicus. So that's centered. I'm inspecting his skin, assessing his skin. Umbilicus is not protruding. There's no discharge. I do notice some striae in the abdomen area. I'm going to take a listen to all 4 quadrants and listen to your vowel sounds, okay? Good. Vowel sounds are all hyperactive at this point. I'm going to switch over to the bell. I'm going to listen to the aortic artery. I'm going to go 2 inches above the umbilicus. Aorta artery. Okay, and then slide over to the left. Listen to the renal artery. And then to the right side. All right, good. Did not hear any pulsation, which is normal. I'm going to palpitate around your abdomen area. Let me know if you feel any tenderness. Do you have any pain?
No.
Before this assessment? No? I'm assessing the firmness of the stomach. Okay, now I'm going to go deeper, okay? 2 inches deeper. Feeling for any enlargement of organs. We're almost done here. All right, good. No abnormal findings. Go ahead and stand up for me. At this point, I'm going to assess Gerardo's spine. So, thoracic area, we want to make sure that it's convex, and around the lumbar area, we want to make sure that it's concave. So I'm going to have you bend down and touch your toes. I'm going to assess his spine. Now, when he's bending down, I want to make sure it's aligned when he bends down with his two scapulas. All right, go ahead and stand up. Assessing the range of motion, I'd have the patient. Gerardo, can you place your hands on your hips, please? And then can you turn from side to side for me? Very good. All right, you can go ahead and put your shirt on. Then we're going to move on to the lower extremities. So again, I've asked the patient to lie down. Then right away, I'd be assessing his skin. I don't notice any lesions. I'm going to assess for temperature. It's warm to touch. And I'm going to assess capillary refill right away. Make sure it's less than 3 seconds. I'm going to compare his pedal pulses. Good. And then feel for any pretibial edema. Next, I'm going to assess your range of motion. Oh wait, actually while you're here, I'm going to assess for Babinski reflex. So I would go around the toes here and then see lateral around the toes. Assess for any flaring of the toes, fanning of the toes. All right, so for range of motion of your ankles, can you point down, point back up? Can you bring this leg out, bring it in, bend your knee, straight out. Can you hold it for 5 seconds? 1, 2, 3, 4, 5. Same thing with this leg, out, in, bend, hold it, 1, 2, 3, 4, 5. Very good. Your toes, can you push down my hands like pedals? Good. Now bring your toes towards you. Okay, bring your leg out, push in, good. Same thing, right out and push in. Okay, can you bring your toes inward? Can you put them out? Good. All right, go ahead and sit at the edge of the bed. I'm going to assess his strength of the knees. I'm going to hold your leg up. Can you bend down? Bend the knee. Good. Assessing the strength of his knees now. Good. Going to assess for your quadricep deep tendon reflex now. I'm going to hit below the knee. Good. You go ahead and stand up for me. We're going to do a little bit. I'm going to start with a neuro assessment and assess his Romberg, do the Romberg test. So I'd ask the client to close his eyes and bring his hands out, feet together. I'd guard his gait for 20 seconds. Make sure that he doesn't lose his balance. Okay, 20 seconds. Very good. Then I would assess the cerebellum function of his lower extremities. Can you run? Oh, you can see. Yeah. Shin up the heel. Heel up the shin. Good. Then the cerebellum function of his upper extremities. Can you bring your thumb to each finger? Okay, thank you. I'm going to watch his normal gait. Take a few steps for me. Okay, now heel to toe. Good. That's all very good. All right, I'm going to assess your deep tendon reflex of your tricep here. Good. All right, go ahead and have a seat for me. We're going to do a light touch assessment. Close your eyes and let me know when you feel the cotton ball.
Now, 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 now.
Okay. And then we're going to do a light to dull touch. This is light and this is sharp. This is dull. Say dull and sharp.
Sharp, 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 dull, 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 sharp, sharp, dull, dull.
Okay, very good. Babinski, Romberg, deep tendons, light touch. Okay, that is all. Thank you.